Okay, so look at the doctor's orders. It says Mary Smith, 14 French Foley catheter, and she's allergic to penicillin. I go in the room. I do hand hygiene, clean my work area. I introduce myself. Hi, Mrs. Smith. I'm the student nurse from TCC. Can you please verify your name and date of birth for me? She says Mary Smith. Okay. And then date of birth is 3/1/77. Okay. Are you allergic to anything? And she says yes to penicillin. Okay. And then are you allergic to tape, adhesive, lubricant, or latex? And she says no. Are you specifically allergic to iodine? And she says no. Okay. So today I'm going to put in a Foley catheter because of your inability to go to the bathroom. I'm going to ask you a couple questions. Are you able to open your legs into a butterfly position? And then she says yes. Are you able to clean your perineum from front to back if I give you a wipe? And then she says yes. And like, okay, great. So like I said, I'm going to insert this catheter into your bladder. It's going to be a little uncomfortable at the beginning. I'm going to tape it to your leg afterwards, so please make sure not to tug or pull. And also please make sure to increase your fluid so we can prevent a urinary tract infection. And make sure that the back is below your bladder and don't let it touch the floor, please. And then I give her privacy. I put the side rail down, the bed up, and then put on my gloves. I tell her, Mrs. Smith, I'm going to inspect your perineum. Okay. So I inspect her perineum. There's no drainage, no abnormalities. Okay. So I take my gloves off. Throw them in the trash. Do my hand hygiene. I inspect this package. It's not expired. It says 14 French catheter. Okay. And then I make a trash and put it at the end of the bed. I start from this one and go up, side, and then down. Since I don't have any gloves, I grab this by the corner. And then do it like this. And then I put on my sterile gloves. I check that they're not expired, and they're not expired. Grab them by the corners. Then I grab it from the bottom. Grab the cups. Okay, and then I can now. And then I can touch this now since I have my sterile gloves on.
No.
Okay, so I put this iodine into the cotton and then go around and throw it to the trash. Go ahead and put this over here and the box over here. And then I put my lube in there around trash. So then I slowly take this off. First, I gotta make sure that it's from the factory. I inspected it. So now I can take this off. And the clamp was closed. Then I put my syringe in there around trash. Okay. Okay, Mrs. Smith, it's gonna be a little bit cold. I'm gonna clean your perineum. So I'm gonna grab this. So now this hand becomes dirty. And then I start with this side, go around trash. And then the other side around trash. And then now the middle. And then I go around trash. So I put lube in this. And then I tell her to take a deep breath. Please take a deep breath, Mrs. Smith. And then I go in, making sure my hands don't touch and they have a distance. And then I see urine coming out. So then I go in a little bit more, 2 inches. So now I grab it with my dirty hand, and then I go down, grab my syringe, and then put it. Okay, so now I pull it back to make sure that the balloon is inflated. It is. And now I grab this from the top and pull my syringe out, throw it away. And then I grab this with my clean hand, rip this. Move everything over here. Set this over here. Then I take my sterile gloves off. Do my hand hygiene, put on my clean gloves on. So now I'm gonna tape this, the catheter, to her leg. And then I grab some tape. And I'm gonna sandwich it. Put one on the bottom right here on her leg. And then grab the catheter, put it right here. And then put the other one on top, making sure that I'm giving her a slack. Okay, so she has some slack now. Then I grab this and put it on the frame of the bed, not the side rails. So now I put my bed up, the rail up. I make sure to throw all my trash away. And then I throw that away. I take my gloves off. Okay, Mrs. Smith, can you, on a scale from 1 to 10, how bad is your pain? Or how bad was the procedure? And she says 3. Okay. So, please, like I said earlier, don't tug or pull. Make sure that it's not below your leg or wrapped around, that it's in the right place. If you need any help, please call us with your call light. And then I do my hand hygiene and exit the room. So then after 30 to 45 minutes, I go back and make sure that the catheter is in the right place. It's taped to her leg, it's not under her. And then I check the urine. It says 30 milliliters, clear yellow urine. And then I do my hand hygiene again and exit the room.